There are multiple ways that you can diagnose malaria. The quickest way is to use a rapid diagnostic test, which has the protein, histidine-rich protein 2 as the antigen. It's not the most sensitive way of detecting malaria, so you need quite a high load to pick it up. And also some of the parasites, due to polymorphisms, may not have this histidine-rich proteins 2 that you're looking for, and so you may think it's not there when it actually is. So the gold standard for diagnosing is actually microscopy. For more sensitive detection, polymerase chain reaction is the best, but for routine purposes, labs would use microscopy as the gold standard. So let's look at Vivax. So Vivax tends to have these enlarged amoeboid shapes.
For Vivax, it invades young red blood cells. The technical or scientific term is reticulocytes. And because they're young, they become enlarged when they're infected. You will see Schaffner's dots. These are fine pink stippling that appear in infected erythrocytes, another name for red blood cells. The trophozoites are highly amoeboid. This is unlike the more compact forms of P. falciparum. The schizonts are common in peripheral blood. You don't tend to see schizonts in P. falciparum infections. It's more the ring stages when you take blood from a patient. So the Vivax schizonts usually contain 12 to 24 merozoites. The gametocytes are also unique. Unlike the banana shapes of falciparum, these ones are round or oval for Vivax.
So here we have more ring-formed trophozoites in a thick smear for Vivax. I may have thought it was cell debris. And here we're having the trophozoite ring form in a thin. So in a thin smear, you start to get way more detail. And I can see that while it's a ring, it's still not, I could differentiate that potentially from a falciparum or malaria ring, because it seems to be not like as perfect a ring. And here are more of the Vivax ring-formed trophozoites in a thin smear.
Thank you so much for checking out the video. I really appreciate you subscribing to our study group and giving the video a thumbs up. And I'm looking forward to catching you in the next video. God bless. Bye.